Well, up first, let's get you the latest data. And 3,780 people have died of COVID in India in the last 24 hours. This is the highest in a day so far and pushes the total fatalities to 2,26,188. India's COVID caseload hit 2.06 crore with over 3.82 lakh new cases as the crisis continues to crush the healthcare system. The positivity rate is 24.80%, while vaccinations on Tuesday dipped to under 15 lakh, which is worrying. Well, to talk more about the India situation, we're joined by Dr. Priya Sampathkumar, who is the Chair of Infection Prevention and Control and Infectious Disease Specialist, Mayo Clinic, Rochester, someone who dealt with this crisis in the United States and is watching India very closely. Thank you so much for joining us, Doctor. Now, it's a desperate situation here currently, and with the second wave overwhelming us, what's worrying is these, huge numbers and how it's spread in rural India. And now many experts saying it's going to get worse before it gets better.
So I have been in close touch with people in Delhi, which seems to be the worst affected. And I just am heartbroken by what is going on. As far as the rest of the country, I have family in other parts of India who really are not even seeming to get the message. They're in India, but they don't seem to get the gravity of the situation. You know how as Indians, all of us are always on 100 WhatsApp groups. And I continue to get the jokes and the forwards from people. And I'm just like, don't you see what's happening? So I don't know whether what I'm hearing from Delhi, from people on the ground, is not getting shown on Indian media, or whether people are shutting it out, or what it is. Because I'm just amazed that I cannot sleep, I cannot eat, I'm so worried. And my other, a subset of friends who are outside of Delhi don't seem to be getting it. So really my question is, what is going on that the average person in India doesn't seem to be concerned? The other thing I'm seeing is wedding invitations, people at parties. What the hell is going on? Why aren't people taking it seriously? So if you're asking, is it going to get worse? If behavior doesn't change, yes, it's going to get worse.
Right. We here at NDTV, of course, are trying to send that message out that, you have to change your behavior. Now, I wanted to ask you that recently one of our top doctors has warned against getting CT scans, especially in moderate cases of COVID. He says it exposes you to radiation, and this has created a lot of a big sensation and a reaction from, people. I want to know about in the US, what is the practice there when you're treating COVID?
100% agree with him. Exactly on point. This needs to stop. So right now the system is incredibly stressed. Everybody in the parts of the country outside of Delhi should be doing everything possible to prepare for, surges in their own places, increasing beds, working on oxygen. Doing these CT scans is useless for the patient, potentially harmful to the patient, and is taking away valuable medical resources. So from, the other preparations that need to be happening. So Dr. Guleria is 100% right that these scans are useless. When the COVID pandemic came in the US, a CT scan was standard because we didn't know enough about the disease. We were just learning. And so we did a CT scan on every patient. We also have easy access to CT scanning here, and we did it on every patient. And really, we have learned lessons from that. And that is why I think it's really important to get the word out. And the lesson we've learned is exactly what Dr. Guleria said, that the CT scan doesn't help in any way. There's no real correlation between the appearance on the CT scan and the outcome of the patient. What matters is the level of oxygen that the patient has. So a simple pulse oximeter reading is much more valuable than a CT scan. So 100% agree with everything he said.
All right, Dr. Priya, I know that, a lot of you doctors got together and put together a tip sheet for us to follow and, just to help out people who may be at home and trying to treat a moderate illness. And you've also spoken very strongly about Remdesivir and said there shouldn't be this desperate rush for it like we're seeing here in India, black market as well. But at the same time, many of you doctors admit that Remdesivir does bring down hospitalization. So you can imagine how this holds out some hope for those people who are desperate.
Yeah, so I think that as the medical community, we need to band together and say that Remdesivir is useless in the present situation in India. So we can tell the public that about trial data. The trial data is, scientific analysis of studies. And this trial data showed that in the hospital setting, and remember these studies were done in the UK and the US, in these very, very stable settings, resource-rich areas, the duration of hospitalization was reduced by a few days. Now, this again is in settings where everybody with COVID is getting admitted simply because we have the beds, we're not overwhelmed. Right now, when beds are overwhelmed, when a patient who's gasping for breath is not able to get a bed, putting a patient in the hospital to give them 5 days of Remdesivir IV for some small potential benefit is criminal, because really by doing that, you're taking that bed away from other patients who could be helped by being there, getting oxygen, getting other life-saving medications. So I think we did a disservice by saying it doesn't really help, but going by the trial data, it does this, because when your loved one is in the hospital, if your mother was in the hospital, you're going to glom on to the fact that, well, it may help a little bit. And you want, it's human nature. You want to do everything possible to help your loved one. So we need to stop saying there may be slight benefit. We just need to say, under the present circumstances, do not give Remdesivir.
And the other, issue here is about plasma therapy. And this again, it's been said that it does not help. It's been proven. There have been, scientific studies as well. But even so, here in India, we see these desperate appeals for plasma.
Plasma does not work. Plasma is useless. Do not donate plasma. Do not try to arrange for plasma. It's a waste of time and money. And again, it's stressing the medical system. Obtaining plasma, doing the testing on the plasma, and administering plasma, which is completely useless, is taking away time and effort that should be devoted to patient care. So I can't emphasize that enough. Completely useless. And I can say that very confidently because the plasma trial started at Mayo Clinic. A good friend of mine led the first trial. We've analyzed it and everyone sliced and diced it and tried to find some benefit from it. It was when we didn't know enough about COVID and we were desperate for any kind of treatment. We also latched our hopes onto it, but it has just not panned out. And if you can get the word out about that, that would be fantastic.
All right, a lot of energy is spent on getting plasma. Now, one of the recommendations that I've seen that has changed from the first wave, and that's when I had COVID, to this particular wave, is all you doctors are recommending budesonide inhalers or nebulizers when you get COVID. If you could tell us about this.
So it's like Remdesivir in that it has a mild benefit. If you use it in early COVID, it helps reduce the cough. So patients again feel better and are less worried about progression. It also does maybe reduce the risk of progressing to need hospital stay. The budesonide is inexpensive. It can be done at home. You don't need a hospital bed. The data is very limited. So the study that showed that it worked was called the Principal trial, and they had 2,000 patients in each arm. And the patients who got the budesonide were less likely to go to the hospital. It was reduced by 2%. So the reason we put it in the recommendation is that A, it's cheap. Secondly, you can do it at home. And thirdly, because the number of cases is so huge, when you have 300, 400,000 cases per day, that 2% reduction is still huge numbers. And if we can keep 2% of 400,000 out of the hospital, that is a benefit. But again, it's not a life-saving drug. Of course, when you put something out in a recommendation, it's sold out by people hoarding it. So it's really not available. And the message I want to give is if you have it, use it. If you can't find it, do not worry too much about not having it.
All right, thank you so much, Dr. Priya Sampathkumar, for speaking to us here on the show. Well, the other issue we're focusing on today, coronavirus and its impact on the heart. We do know that those who already have an underlying heart condition and hypertension could experience a more severe illness. but the infection can also have a long-term side effects as well, and it becomes important for patients to therefore get their heart checked after making a recovery. In fact, it could take even months after the disease to make a full recovery. Well, to talk more about this, we're now joined by Dr. Ashok Seth, Chairman, Fortis Escorts Heart Institute, Okla, and Dr. Rajneesh Kapoor, Vice Chairman, Interventional Cardiology, Medanta Hospital. Thank you both, doctors, for taking time out in your very busy schedules and joining us on the show. I'd like to start with you, Dr. Kapoor. If you could tell us about the risks and the impact that COVID has on hearts.
Yeah, absolutely. So it's not that COVID is only a lung disease. COVID also impacts heart in multiple ways, and in many cases, involvement of heart is a deteriorating factor with COVID. So one way it impacts heart is that because of this inflammation, there is a cytokine storm which is happening, and that may also involve the myocardium, leading on to myocarditis. That is one aspect. But what is more worrying now is that COVID is a state which is enhancing the vulnerability for thrombus, the clot formation. So that clot formation actually may result in acute heart attacks. And these heart attacks can be happening during the COVID time while the patient is having active COVID disease, or even after the COVID disease has occurred and patient has got better from COVID after 2 to 3 weeks. Still, the risk of heart attacks is quite high, and the patient is highly vulnerable. So this has to be really considered, that which are the patients who have to be treated more meticulously from the aspect of, that they are more vulnerable from heart point of view from COVID. Yeah.
Right. Dr. Seth, initially it was thought that those who face a serious illness are hospitalized, they were the ones who were at risk of these, long-term effects. But now it's being found even in those who've had a moderate illness.
Absolutely. It's an inflammatory response of the body. And we must remember that the heart disease, the heart is affected in 3 different ways. Inflammation itself leads to increased coagulability of the blood, which means formation of clots. Secondly, it also leads to inflammation within the arteries of the heart, and again, rupture of the blockages leading to clotting as well as heart attack. So that clotting can affect the heart arteries leading to heart attack. It can affect the lung arteries leading to pulmonary embolism, as we call it, and sudden drop in saturations and breathing problems, or it can even go to the brain and create strokes. The second way we understand now that it affects is that inflammation also affects the heart muscle. And it's not a direct virus which starts infecting it, but it's the inflammation, and that leads to decrease in the heart muscle function. The pumping efficiency of the heart goes down, heart failure sets in, and gradually a shock situation can set in. And finally, the same inflammation, if it affects the conduction system of the heart, can lead to suddenly and serious fast heart rates or extremely slow heart rates, leading to collapse and cardiac arrest. Now, this may happen even in moderate disease, but the deaths from severe disease, clearly 20 to 50% deaths are not lung problems, are related to heart problems. And this inflammation can continue forwards beyond recovery, beyond when the virus has gone away, because you all realize that the virus disappears in terms of replication within a week. And it's actually what carries on beyond is the body's inflammatory response, or the inflammatory response of which the virus has set in for a much longer duration, causing most of these complications over a period of time.
Right. So, Dr. Kapoor, if I could ask you here, what is one supposed to do if one has recovered from COVID and, get regular checkups done? How does one deal with these risks?
Yeah, absolutely. This is very, very important. Now, patient may be getting complacent, thinking that they have gone beyond 2 to 3 weeks after COVID and may just relax, but that is not the case. So they should have a plain echocardiogram to know whether this COVID infection has impacted the heart myocarditis or the heart function in a detrimental way or not. That is first step. And then a plain ECG also, because at times that ECG also tells us whether patient is having some conduction abnormalities because of COVID. I recently had one patient who totally improved from COVID, but after 2 weeks of COVID, subsiding, coming out of COVID, he had conduction problems, and he actually had so much so conduction problems that he required a pacemaker. So ECG, a plain echocardiogram, and the patients who are more vulnerable, like they have risk factors for heart disease, they should also get a CT scan looking at the coronary arteries of the heart, because there is a possibility that this COVID has made these patients highly vulnerable for blockages or the clot formations in the artery, and may lead to catastrophes in such patients even if they have improved from the COVID.
Right. Dr. Seth, this issue of, blood clots is something that is a big risk, that or at least people worry a lot about it. What can be done about, lowering your risk of blood clots?
So we must remember that all patients who have moderate COVID disease or get admitted to the hospital, it's a clear recommendation to start them on blood thinners. Now, the severity or the potency of the blood thinners is decided based on the situation itself. And one of the tests which guides us is not just the severity of the illness, but a test called D-dimer, which reflects the tendency for clots to occur. And those who have raised D-dimers are given more potent blood thinners. Those who are actually going on to a mild to moderate disease without greater changes in inflammatory parameters can do with milder blood thinners like aspirin and clopidogrel. But these blood thinners are heparin. They are low molecular weight heparin in the hospital, the more potent blood thinners, and they're given to practically all moderate patients who have raised inflammatory markers and moderately to severely raised D-dimer fractions. These are then carried on even after discharge for a duration of time, usually a month, but based on the severity of the illness, based on the test subsequently, may be continued for a longer duration to prevent clottings. These drugs are mandatory, I would say, in many instances based on the decision of the doctor and not to be decided by the patient. But certainly I would say that the patient should be aware of it, so that this is one of the things that when being treated, he can ask this question whether he's in that category of requiring a potent blood thinner to prevent clotting and to prevent subsequent catastrophe, and whether he should be actually discharged on this for a duration of time.
All right. Well, let's now open up to our viewers, and we have some questions coming in. Not all of them are heart-related, I'm afraid, but we have our first caller, Mohideen. Go ahead with your question.
Yeah, ma'am, I'm from Mohideen. I'm from Bangalore. I got 3 questions. So actually, in the month of March, I got tested positive. So my oxygen levels were 98 only. So for 3 weeks, I was in the home only. Again, I got negative test. So I was in the home only. But is it required, because this regarding this blood clotting in the heart? So I wanted whether I had to take this blood thinner and all. Actually, that is question number 1. Then this vaccination after this COVID positive tested report. So after how many days we have to take this first dosage?
All right, let me take that question to Dr. Kapoor. Dr. Kapoor, if you could answer him again a question regarding blood clots.
Yeah, absolutely. So even if you have become negative from COVID infection, I think it's important to still get scanned from heart point of view, whether you are at risk even after the COVID. This is very important, and we have seen the events happening post-COVID, and we have lost lives. So this is extremely important stuff. You should consult a doctor, scan yourself from the point of view of heart disease risk factors, whether you are obese, diabetic, or other risk factors. And I think if you are beyond 50 years of age, it is imperative to continue antiplatelets at least. A simple aspirin is good enough at times to prevent these events post-COVID.
Right.
So based on your risk factor analysis, you should be given antiplatelets and to be considered for anticoagulation also based on your risk factor profile.
Right, after consulting the doctors. We also have a tweet question. Sparsh Oberoi sent this question. If a person has had angioplasty, that stents implanted, and gets positive, then what kind of extra precautions does that person take? And with doctors overworked, can one take guidance from a general physician? Dr. Seth?
So yes, you can take a guidance from a general physician. In fact, a physician, you should say, because these days we have created enough education and enough information for all physicians to be able to handle mild disease which is outside the hospital. Obviously, moderate disease entails in most instances treatment within the hospital. Now, as far as your specific question about stents is concerned, we must remember that do not stop your antiplatelet medication when you get COVID. We have to understand that we need to keep the blood thin, especially as you've got stents. And certainly in mild disease, you don't even have to upgrade that into anything apart from staying on the antiplatelet medication like aspirin or clopidogrel, which has been prescribed. However, one gets to, if one was to actually move into that moderate situation where the oxygen starts dropping or you require admission to the hospital, you would automatically be also started on the heparin blood thinner, as I've told you. And that blood thinner is a good blood thinner and would be given in addition to the antiplatelet medication that you're taking. That is a decision of the doctor. You don't have to change anything, but you just have to continue your antiplatelet for your stents as prescribed after you get COVID.
All right, we have another caller. We have Anoop calling from Bengaluru. Go ahead with your question, Anoop.
Had gone through an open heart surgery, bypass surgery around 5 years back. And now he has got COVID and he's recovering well. You know, he's into the 8th day and his oxygen level and the temperature, everything is fine. So my question is, should he continue the medicines which, you know, he has been taking for the last 5 years?
Dr. Kapoor, his father underwent a heart, has an open heart surgery and got COVID. Yes.
Absolutely. All heart disease patients are more vulnerable if they get a COVID infection. So there is no questioning that he has to continue all the medication which he has been taking from heart point of view post bypass, whether they are antiplatelet drugs, whether they are other beta blockers or other stuff. If there are no contraindications for that like asthma or anything, he should continue with all the medicines which has been prescribed post bypass regardless of the COVID, and then get treated himself for the COVID, and if he is COVID negative, just continue with these drugs meticulously. This is quite important.
All right, we have another tweet question from Suresh, and he asks that for heart patients, do we need to undergo any precautionary tests and doctor consultancy before taking vaccination? I heard this is the case in some countries. Dr. Seth?
So I think I want to really emphasize this slightly in detail because it's the question most asked by all heart patients. They asked, in fact, public asked this question that I've got heart disease, I've had bypass surgery, I've had stents, I've got previous cardiac problems. Should I take a vaccination? I want to emphasize that that is the reason you must take a vaccination. It is clearly recognized that patients who've got heart disease have a more serious form of COVID. They may not be more predisposed to COVID, that's not yet been fully answered, but certainly more serious form of diseases, COVID. The second aspect is it's not just heart patients. This question is asked by diabetics, hypertensive, people who've had cancers, and they all ask this question, and they have on immunosuppressants. Very important that one must take a vaccination because you're prone to severe COVID disease. The second aspect is the question which is asked by heart patients is, but I'm on blood thinners. Isn't that a contraindication to taking the vaccine? We must remember that blood thinner is absolutely no contraindication to taking vaccine. Majority of the heart patients are on the mild blood thinners, which are aspirin or clopidogrel, and they are absolutely cause no problem in a vaccination. So you just need to just walk in, have it done. I take aspirin. I had vaccination. My 97-year-old father takes aspirin, and he had the vaccination. Now, the second aspect is that there are more potent blood thinners, like especially one which is given for dissolving clots. These are like warfarin, acetylcholine. Patients with artificial valves have these. Patients who've had clots in the lungs have more potent blood thinners. So acetylcholine, warfarin, and others called apixaban, dabigatran. Now, these are also not contraindications, but you must inform your doctor before taking the vaccination because you may need to just miss out a single dose, or the doctor may just want to test your blood to see how thin it is and then say, okay, don't take it for a day or decrease the dose for a day and then go and take the vaccination. And all you need to then do is have a vaccination, just keep the arm, the point of puncture, press for 2-3 minutes, and that's all that's required. So absolutely must have vaccination and be confident about it. These are the very reasons you should have vaccination.
All right. Well, thank you so much, Dr. Kapoor and Dr. Seth, for joining us, taking time out and answering all those questions for us.